Hello, everybody, and thank you for listening to the Healthy Project podcast. I am your host, Corey Dion Lewis. I have a great guest in the building today, physical therapist Pat Ford. Dr. Ford, thank you so much for being here. I really appreciate it.
Yeah, ever since I met you, I was really excited to try and be a part of this. So I'm really just happy that you invited me. So thanks.
Yeah, man, and what I'm really excited about also is not only are you a physical therapist, which um, is a great thing to be, as far as as one of the professions being kind of on the front lines of helping people get back to their health, but you're more than just a physical therapist. Like you do more that you social determinants of health, which we'll definitely talk about today.
Yeah,
Health disparities with especially working with people of color. So those are things I'm really excited about, and getting the audience to listen to and get some value from. So I'm super excited to get your knowledge and kind of get your which how you feel just from your experience and seeing where we can go from here. So
yeah.
before
Well,
we yeah, sorry, man. um
no, it's good. I just hope like I have something that can help a few people out. I've learned so much from others, so I really welcome this opportunity.
Absolutely. Well, before we get into it, man, tell us, a little bit about yourself, how you started and how you got to what you're doing today.
Yeah, for sure. Well, like you said, my name is Patrick Ford. I grew up in the suburbs of Chicago, small suburb called Mount Prospect, small comparative to I guess some others. And I went to school at Iowa State University, got my bachelor's degree in kinesiology and health with a focus on physical therapy, and ended up going to physical therapy school at Creighton University, which is in Omaha. Um, from there, I graduated 2018 and wanted to move back to central Iowa to be with my wife and for us to kind of start our life here, and found a good paying job with doing what I want to do. And I've been practicing PT for the past 3 years. So,
Awesome, man. Awesome. So
yeah.
with your experience working, with physical therapy, how does how does the people that you work with, do you work with a lot of patients that are um kind of affected by social determinants of health, or how did your passion for health disparities and focusing on social determinants of health, how did that come along through your physical therapy practice?
Yeah. So, to answer your first question, um, to be honest, not as much as far as working with people that deal with more of the social determinants of health that might negatively affect them. I think everybody has components of the social determinants, and we can kind of list some of those off here. Everybody has those qualities. It is whether or not it gives them an opportunity to
Mm,
achieve a greater health status, right? You're looking at economic situation, their education level, or their access to education around health, the neighborhoods that they live in, their healthcare access, if they have health insurance, all that type of stuff, and their social environment. So people have components. Everybody has those components in their life. It's just a matter of like which one of those, how do they stack up in each one of those sections, and how does that give them either opportunity to live a healthy life, or maybe kind of negate them from having that access and maybe put them more on the negative where it's more of a struggle for them to achieve that. And for me, I work in a couple different areas, and I've worked kind of all over central Iowa for my company. And I've seen it more in other places where people maybe struggle more economically, or their education level is a little bit less. But right now I work downtown in Des Moines, um, just down the street from Wells Fargo,
mm,
which, if you don't know Des Moines, that's kind of like the good part of Des Moines. Downtown's pretty clean, and there's a lot of
right.
well-to-do people in that area. I also work in Waukee, which is a growing neighborhood. It's kind of that west side of Des Moines. And if you know anything about Des Moines, the further you go west, the bigger the houses get. So
Right.
um, I don't see a lot of people that struggle to live a healthy life. Um, and I think actually that's part of the passion for me to do the work that I'm doing with the nonprofit. And we could talk a little bit later about
Absolutely.
that.
Yeah.
Um, the thing that got me into this type of work and this type of research, as far as the stuff that I've looked up and stuff that I've learned more about this, was really the murder of George Floyd. Last year, it hit everybody a little differently,
Yeah.
just because I think it was so visceral for all of us to experience, and we all just really didn't have a choice but to absorb that experience. But for me, is I have my daughter. She was turning 1 around the time, and I saw myself more as a father, and I just identified a little bit more strongly with the situation, and I felt like I needed to do something. It's always been a part of my values to, respect my African American heritage. And I consider myself as a biracial Black person. My mom is white, my dad was Black before he passed away, so I come from a biracial background, and I've always wanted to do more, and this was my opportunity. And I was like, well, I don't know anything about social justice as a in regards to criminal law and police brutality and all of these other things, but I do know about health. I know about health. I know about fitness. Those are the things that I learned about that I'm really good at. So I was like, okay, I'm going to just learn about that, because I know racism is everywhere and I know
Right.
it's affected everything. So I'm going to figure out how it's affected healthcare and people that look like me. So really, that was kind of the spark for me to start researching it. And it kind of confirmed everything that I was fearful of. And kind of along those lines, I wanted to see what other Black therapists existed in the area that I can start kind of networking with, that I can start talking to about their experience in Iowa and see if there's reflected my own. And I'm not even kidding. I probably researched hundreds of therapists, and I did not find a single Black physical therapist in Iowa. Not saying I've seen every single person that practices in Iowa, but I'm still waiting for somebody to reach out to me, because I've looked from Des Moines, Iowa City, Cedar Rapids, Davenport, Council Bluffs. Like, I've looked everywhere, man, and I
Wow.
cannot find anyone. So if that's not enough of a motivation to try and change that, I don't really know what is. So
Yeah, that's a whole lot. So outside of being solo in these physical therapy streets, you know what I mean? What are some of the biggest needs through your research,
yeah,
everything that you've been looking into? What are some of the biggest needs that you see in the medical, we can talk about the medical community and just in the community in general?
yeah. I think I would like to start by going back to the social determinants of health, because that is a big deal. And we can use Des Moines as kind of a little sample size for ourselves. And if you guys aren't from Iowa, you probably already have, your own bias of what Iowa looks like. And I promise you, it's like almost 100% correct. Like, there's not a lot of Black people here.
Right.
Like, but there is a community of Black, brown, and other people, especially in the Des Moines area. And I researched some of the stuff, some of the social determinants, and I started looking at economics. And if you look at the economics of the average family in Des Moines, the average family, I think, makes around $50,000 to $60,000 as a family household. That's considering every single person. And then if you look at African Americans specifically, I think it's maybe $15,000 to $20,000 less per year for the household, which is a substantial amount of money. Like, you are talking about the difference between working 1 and 2 jobs. And when a parent has to work 2 jobs, or you have to now rely on the younger members of your family to contribute to your household, it makes a big deal on what you're going to prioritize as far as spending your money. It's like rent, gas, electricity, food, and then, like, that's what you're going to do. And if you're
Right.
working your life away, like, you're also going to try and do things to kind of just treat yourself as well. So uh, if we're looking economically and we just look at family income, that huge gap, and almost, what, 33% less income per year, that's a huge deal. If people can't afford their health, they can't live healthy lives, that can't afford the type of nutrition counseling or the healthcare that they need, or having a fitness membership, or finding a coach that can help them move through these different situations and live a healthy, active life, then they're set off at a disadvantage. And that's just one component. And that we're not even looking at net worth either. If you look at net worth, what net worth of the things that people actually own
Mm-hmm.
and the value of that stuff, the gap gets even larger. So economically, there's a big disparity in the central Iowa area. And then you can look down at like neighborhoods. So what I did was I looked at the demographical distribution of Des Moines and greater Des Moines area, kind of West Des Moines. And basically they kind of charted it as different shades of like yellow to red. Red is higher density of that population. Yellow to white is like there's a less density of that population. But when you look at it, and my bias is to look at Black people and white people, see what they're doing, right?
Right.
And you can see just in that kind of pocket of North Des Moines, right along the river, if you look at the population of Black people in that area, there's a big old red spot right in that area. It's maybe 3 square miles, 2 square miles, where the largest density of Black people live. Okay, all around that, it gets more faded out.
Right.
And then if you look at the population of white people, it's the exact inverse of that, the exact inverse. And that's just like a
Wow.
fact. I showed that to somebody who lived in Des Moines for a long time in this area. And he's like, yeah, that hasn't changed in 50 years. And again, we're always seeing like, okay, well, this kind of separation of these tribes has been present and probably has been there for a long time on purpose. And then you start looking at the actual healthcare that's located in those areas. And there is one hospital within that dark spot that all the Black people live that they have the closest access to. Okay. And that hospital, and I'm not saying Google is the ultimate tool to determine if something is high quality or not,
Right.
but that hospital has less than 3 out of 5 star rating for the quality of care that they give from the perspective of the people that have rated it. Okay.
Mm.
If you go further out and you know Des Moines, the further you get out toward the west side of Des Moines and West Des Moines, Clive, Urbandale, you're going to see more specialty care. So if all of your specialists are out in the west side and you don't have access because you're only making $35,000 a year, you only have one car for your family, the local transportation system sucks, you can't get out
Mm-hmm.
there, what are you supposed to do? Okay. And we haven't even talked about trust in the healthcare system.
Oh,
So you're seeing now the geographic location, the economics are all playing into this. And now I kind of want to get into the piece where the social environment plays into it too. And this is kind of on the culture as well. And this is what the research shows from people's perspective, Black Americans' perspective in their culture, that there is kind of more of like a culture where you can't show weakness, right? Like you
mm-hmm.
can't go to the doctor, like, because you're fine. Like you have to be with males, like you have to be the man. Like
Right.
you can't show weakness. Going to the doctor saying you're sick is showing weakness. If you got hurt, you can't go, right? Dust it
Right.
off and get it done. And I'm not saying everybody's like that, but that is a trend that can happen in Black communities that I think can stop us from accessing those services when we need them. Okay. And then you can look at your support from like your family and the surrounding community for like, okay, well, even if I am sick, there's a greater need somewhere else in my life. I'm not going to address my health before I address this other thing. So I'm just going to let it kind of go away. So it's not even just like being masculine or anything like that. It's like my priority is that I need to go to work because I need to make money. And
Mm-hmm.
even though I'm hurting or I'm sick or whatever, I'm going to work. I'm not going to the doctor. And if I do go to the doctor, it's going to be a short visit because I need to be in and out. Okay?
Right. Right.
So like that. And then the last thing, which kind of moves away from the social determinants, is representation. And we just talked about this with physical therapists in Iowa.
Yeah.
Lack of people of color, specifically Black people in the healthcare field, is one of, I think, the large reasons why the disparity continues to exist.
Yeah, I looked into this. This was a few days ago, and I knew I was gonna be having this conversation with you. And I like how many. I wonder how many Black primary care providers there are in Des Moines, and I think I found one. And I was like, let me, out of all of Iowa, I only found one African American male who was a primary care provider, someone that you went to for your yearly checkup or
Yep.
whatever. That's I mean, I shouldn't be excited that I found just one. You know what I mean? That's not enough. But
Yeah,
it's,
bro.
and even though I get it, we're in Iowa, like it's it's not like we're in Atlanta where you can walk down the street and bump into a primary care provider. But it was just so interesting to me that there is this mistrust in healthcare, and I've seen it. I've spoke with patients who didn't want to follow up on preventative services because if I go to the hospital, then I'll be sick, or that kind of mentality. And you only wonder if they had somebody that looked like them, that was a provider, right? Like, me being a health coach and being able to try to talk them through to it. That's only so much I can do, because a lot of older patients, or older healthcare consumers, they only listen to the doctor. They want to see the doctor. They don't care about the nurse. They don't care about nothing else. Where's the doctor at? So I only can imagine if this person that I'm trying to reach out to come in for preventative services was actually able to see a doctor that looked like them, um, would the outcome be different? You know?
Hmm. Yeah. I'm glad you did that research. I think you probably felt similar to me. You could tell me if you didn't. When I started my research, I was really excited. Like, I'm going to find somebody else, and it's going to be awesome because now I can connect somebody that shares literally the crazy unique experience that I have, and I apparently solely have in Iowa. And the longer I searched and less that came back, the more and more upset I was getting about it. And I was actually getting like visually upset. Like, I would go into work and be not a happy person. Like, and it just like kept hitting me. And just like you said, like, I found the one, and like I'm kind of excited, but also like really sad about that. And it's kind of like
Yeah.
crazy. And I've looked into kind of Black providers as well. And really, you only see like specialists. There's a couple like neurosurgeons, some ER guys
Yeah, we
out
definitely
there.
have
But
some dentists and
mhm,
things like that. But I was specifically looking for, if
yeah,
I had a cough and I wanted to go see my doctor, was there a primary care provider that looked like me?
yeah,
And my mess up was I found them the first try. Like, I went to the first hospital, I was like, oh, bet.
yeah.
And then it was just downhill from
What
there.
hospital?
It was at Mercy.
Okay,
It was a
so
clinic on the east side.
this plays into another good part of why there's an issue. If you look at where healthcare providers go to work and you look at healthcare shortage areas,
Mm-hmm.
um, where there's basically, they kind of like talk about this with food deserts. It's similar with healthcare
Yep.
providers, that there's basically a desert of resources in that area. The providers that are more likely to go into these neighborhoods where there's more Black people are other Black providers. So it's like, now we're making our providers work in these areas because they feel maybe obligated, and they feel like a passion to
Mm,
work with people that look like them because they want to give them service. But also, the pay really isn't there for those areas. There's some situations where you can get maybe a little bit more, but they're probably potentially taking a cut in pay because the infrastructure of that area isn't as sound because the city hasn't cared as much about it.
right.
Um, so now you're looking at, well, yeah, maybe I do have a Black doctor, but it's at the only hospital, the only clinic that's in our area. And if I wanted to go see a Black provider, now somebody can't even research it. Like, I ask you to go find a white provider, or even let's say white female, and be a little bit more specific so that we can hit another demographic. You can find one in 10 seconds.
Right.
Like, not no joke. If I asked you for a Black provider, like just like we ran into. If you didn't know the area, you're going to spend some time and then you're going to basically either say, well, I don't care, I'm just not going to see one if it's not Black, or you have to go to somebody that you're not really comfortable seeing.
Right.
So that's a big issue.
Yep. And so, and that's the issue a lot of people have, here, in our area. So my next question is, given that if you're a person of color, more than likely your provider is going to be white. How can we, or how do you feel that we can get, bring confidence back into the healthcare consumer? Like what are some things that we can do to, people can feel more confident and comfortable going to the doctor?
We need to be better. We need to be better healthcare providers. And I hate to keep kind of saying like, let's go back to the research, but truly they've done research on implicit bias in care and provider bias and how these things are set up and what us as clinicians bring into those spaces. And they found that everyone comes with some bias, and it's typically a bias against darker skin color and a bias toward white providers or white demographic. Um, and sometimes that's brought into the actual care that they provide. Not so much into like, so they did like research with hypertension, patients that have hypertension or high blood pressure. And in real life scenarios, the doctor, despite any bias that they had, still prescribed similar medication. Okay. But what they found was that their interaction was deemed more dominant when they're interacting with a Black person. So a white doctor interacting with a Black person, they took up more time over the conversation, and they kind of just basically didn't give the person input into their plan of care, what would make them better. So now you're kind of still playing onto this long history of like, I just have to listen to you because that's what we've been trained to do forever.
Right.
And that doesn't yield better outcomes. I've tried that strategy with clients, like, you're doing this program, like, this is what I'm giving to you. Like, I don't really care about your opinion and how this is going to work out because these exercises are the best. And guess what? Those people don't do those exercises, and those people don't follow through. They don't come back. So I think a big part is us recognizing those biases, actually doing tests to see where our biases exist and doing training and expanding our experiences so that we can negate those biases. And again, they looked at nurses that work with amputees and people that end up being wheelchair bound. And these nurses that had biases prior to work with this group of people, that bias was eliminated just by them interacting more frequently with this unique group of people that they had to now service. That they're like, I have experience seeing what this person is going through, and now I can have more empathy for what they have to experience, instead of saying, well, like somebody in a wheelchair that maybe doesn't even look like they have a reason to be in one. Maybe they're just like, yeah, they're just like lazy, or they're
Right.
not really hurt, or blah, blah, blah. But now you have one-on-one experience seeing what this person is going through. You've had discussions with them. You understand how hard it is to navigate all of the visits that they have to go through, maybe the medication they're taking, how hard it is to do wheelchair ambulation and transfers and all this other stuff you have to do. So even simply by doing purposeful interactions with the group of people that you have less experience with can change those things, as well as doing personally catered coaching or education surrounding these topics. I think it falls on us as providers to gain their trust by diminishing our bias.
Right. Right. That's good. Do you think that, when we're talking about diminishing bias, is this something that should be also taught at the education level, where, when you're in physical therapy school or when you're in med school? Like, I'm curious, is this something that's already being taught at that level, or is it something that's just kind of pushed to the side and not talked about it at all until now, when we're starting to see it more in the spotlight?
There are some initiatives in school, like all I can speak about is my experience and what
Yeah.
I've read up on, but my school did have some cultural. It's more of like a cultural competency type of coursework where you try to, learn more about biases or how you can diminish your discriminatory behaviors or whatever else it may be, and try to implement those practices. They mostly teach you about recognizing those things, but there's not a lot from my experience of how to address them. And again, a big part of that is like, are we even getting experience interacting with these people that we're talking about? Like, we could talk
Right.
about this stuff all the time, but like, if we're not interacting with them, how do we know how to navigate that? How can I become culturally competent if I'm not interacting with the culture I'm trying to be
Right.
competent or proficient in? So like in Omaha, where Creighton is, there's a large population of Native Americans or indigenous people. And in our program, we talked a bit about it, and we have one clinic that does pro bono care that you can kind of go and do some time at, in which I did do some volunteer work at when I was there. But our program had it so ingrained that they kind of missed the bill on it. And I
Mm.
want to give you an example.
Okay.
In school for PT, you do basically skill checks. Like every semester, you go over the skills that you learned during that semester so that you can make sure that you're doing it right and that you can kind of take that next level up. And they do these based off of kind of like case studies. So you'll have a person, they'll get their like little history, what they're going through. You'll have Bob, and he's 45 and he has knee pain. You'll have Cindy, and she's 36 and she has a shoulder injury. And then, this is like not even joking, they said, you have Little Thunder, that was the name of the person. And they explicitly stated he's a Native American and he had blah, 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 blah. And I was like I understood what they were trying to do, but they
Right.
missed the bill so hard,
Yeah.
because it's like, there's Native Americans that are named Bob too. Like, why
Yeah.
why do we have to swing the pendulum so far?
Right.
Because we're trying to overcompensate for a
Right. They're doing
clear
way too
lack
much.
of our program's own proficiency in culture.
Mm.
Like that's way too far in the direction where you're trying to go, that you just fell off the edge. So there's definitely a lot of work that needs to be done. And a big part is, in these universities, they need to have people of color leading programs, leading classes, leading courses. I had zero people of color that were teaching me that I can see as an example of what I was trying to become or what I was trying to achieve, or to give me a different perspective. Even if I'm a white person and I see a Black teacher, um, then I can have an example of somebody that I'm trying to learn more about. And I'm going to take that back. I had one AAPI teacher. Um, she's Asian American Pacific Islander heritage. That was the only one, and we had some experience with her. So I want to give her credit. But
Right.
when you don't have that, like that compared to the other, I don't know, 25 staff members, like that's not enough. So like we need to improve representation within that group. We need to expand our experiences for our students so that they can actually see what's going on. And you could see this actual bias come or reduce in medical students, because they'll test them at the beginning first year and they'll put them through some of these purposeful experiences, and that bias will go down. Like
Mm.
that, it works simply that easily. Like, you want to
Right.
educate them and everything, but giving people experience is a
Yep.
huge deal.
Yep. Absolutely. Let's change topics a little bit because I want to get to this wonderful organization that you have. Not only are you, trying to do great stuff in physical therapy and health disparities, but you trying to change kids' lives, man, with Project Onyx. Can you talk to us a little bit about Project Onyx, how it started, and
Yeah.
where do you see it going?
Yeah. Yeah, I got my Project Onyx t-shirt
I
on,
gotta
always
get one of
positive
them.
energy. Yeah, they're
I
on
gotta
sale
get
right
one too.
now. You could check them on I think it might be on our Instagram. You could find a link.
Hmm.
I'll make sure that it's in there now that this is reminding me. But it all went back to last year around the same time. I researched everything about health disparities, everything that was going on in my world that I felt passionate about addressing. And then I'm kind of like an all or none type of person. Like when it came to PT, I was like, okay, I want to be the best. Like, so I went and got my specialization. Like, I'm kind of the only therapist at my clinic. Like, I wanted to be the best. I was all in. And I was the same thing with this. I was like, okay, I know what's happening. I know what the issue is. So I'm going to eliminate health disparities. That is the goal that I set out for myself. And I was like, okay, well, how do I bring this to the community and then expand it? Like, if I'm going to eliminate racial health disparities, this needs to be happening everywhere. And obviously starting somewhere. And there is a lot of stuff going on in the CrossFit world at the same time. And for those who don't know, brief history on that is CrossFit is an organization that has created a fitness style of training that is branded under their label of CrossFit. And CrossFit as a company previously had a CEO that during the aftermath of George Floyd's murder said less than appropriate things about the whole situation, kind of comparing George Floyd's murder, and he tweeted Floyd 19 as it was like another kind of just hoaxy type of situation. And he's just really diminishing the intensity of the situation, along with other incidences that kind of that really exposed his toxic masculinity and his misogyny and all this other stuff. So CrossFit was under a lot of scrutiny because this shed light on the greater culture of CrossFit, which is largely white. Most of the people that do CrossFit come from white backgrounds, and they're worldwide and they have stuff all over the world, and they've showcased that in the past, but they don't showcase the people of color that live in the states that do the sport as much as they should. And I think it's getting better, but this definitely wasn't happening as much as it should have before. So I knew of a CrossFit athlete that was living nearby me, that I was like, I need to get this guy on board because I care about CrossFit as a methodology, and I care about health and fitness. And I think he's the one that can help me kind of combine the two, because one way for us to change our health is through fitness and physical activity. So I literally just sent him a message on Instagram. I'd maybe kind of briefly chatted with him a little bit before that. But he saw my message. And 10 minutes later, he's like, yeah, come over. I'm in my garage. Like, we'll talk about it. And I walked over to his garage. He was printing off Black Lives Matter shirts because he was selling them and donating money at the time. And we had like a 3-hour conversation about what I was envisioning for something that I wanted to do. And he was on board. He was very passionate and kind of in the same kind of limbo that I was in. And he's like, yeah, I'm all in if we can help Black kids. Like that's basically what he was like. And I was like, all right, like we'll definitely start there. We're going to start with kids, and we're going to give them mentorship, and we're going to give them a space where they can work out, and we're going to help guide them through these challenging situations. And that's how we started Project Onyx.
That's dope. So what's the meaning behind Project Onyx? Like how'd you come up with that name?
So many people ask me this question, and Elijah, after we finished our conversation, the guy I'm talking about is Elijah Muhammad. You could look him up. After we had that conversation, he's like, all right, we need a name so that we can kind of just start labeling things, and we can kind of create a logo. We could do all this other stuff and really brand what we're doing. And it probably took me like 10 or 20 minutes after that to come up with the name. And I was like, like if what we're doing truly is a project where it's something that's going to be ongoing and that it's going to take all of us to achieve, that it's, and to be honest, I'm not going to eliminate racism. I don't think anybody's going to get rid of it, but I think that we can treat it like something that we can continuously just take jabs at it, that we can continuously fight back to the point where it's so eradicated down to the very few that we see exposing themselves as racist or practicing in racism. So I just saw it as like a project that it's going to take the whole squad to get this done, and it's going to be ongoing. And then Onyx truly was just referring to Black Onyx, the gemstone, as something that is high in value, but maybe doesn't get the notoriety that it
Mm,
deserves. And if you look into onyx stones a little bit closer, there's kind of a cool little metaphor in there because they're composed of all colors. They come in all colors, and they're composed of all colors along the spectrum. So if you're thinking about this as like an inclusive, diverse group of people that are trying to make a community that is welcoming and accepting of everybody and provides equitable care to those who need it, then the onyx stone kind of reflects that perfectly. It's, I think, a great metaphor for what we're trying to do. So that's how we came up with Project Onyx.
yeah, that's dope. That's dope. So it sounds like you got a lot of work ahead of you, but I mean, like you said, man, you can do it. It's getting started, and you're starting with our Black boys here in Des Moines. So that's perfect.
Yeah.
So Pat, thank you so much for being on the podcast today. If anybody wanted to get to learn more about you, connect with you online, support Project Onyx, where can they find you, and where can they see you at?
Yeah, me personally, I mostly, if I'm doing anything, it's on Instagram. My handle's patford.dpt on Instagram. Mostly you're going to see photos of my daughter Elena and my wife Sarah, or you're going to see Project Onyx stuff on there. If you want to look at Project Onyx, you can go to projectonyxdsm.com, or you can go to Project Onyx DSM on Instagram. Same thing, DSM for Des Moines. And you'll see all the stuff. We have a link to our website and to our donation page on our profile. You can see all the stuff that we're up to with our youth programming that we're doing, the mentorship program that we've started doing, and some of the other projects that we've been working into. We've gotten to sponsor a lot of kids to do competitions for fitness and wrestling and other things like that. We've gotten one of our young mentees to start a photography business. We've gotten another kid to start some graphic imaging, and he's going to do some work with some people, all through these opportunities that we luckily have had the great opportunity to help them assist that process. So we have a lot coming down the pipeline in regards to that, and even more. Like I said, this is health disparity. So once we get the chance, we're going to expanding to healthcare and to helping out adults and everybody that needs help as soon as we can. And we're going to be expanding outside of Des Moines. So look out for what's to come.
That's awesome. That's awesome. Dr. Ford, hey man, again, thank you so much for being on. I really appreciate your time. And everybody, thank you for listening to the Healthy Project podcast. I'll holler at you next time.
Yeah, for sure. Thank you so much.